Namaste. As we all know, blood transfusion is a life-saving treatment and should be undertaken in a hospital after consent from a patient or the recipient, and every transfusion involves a risk which can be fatal to the recipient, and hence blood safety is a crucial step for successful transfusion. The two most unwanted transfusion complications in a recipient is transmission of transfusible infection and ABO incompatible transfusion. Here at Apollo Hospitals, we are screening all the blood components which are procured from the donor by the chemiluminescence technology, and also the window period screening is done through NAT testing, and hence we ensure that blood components are free from any of the TTIs. The ABO incompatible or missed transfusions which occur are 100 times more common than the TTIs, and is reported by shot at an incidence of 1 in 13,000 in Quebec or 1 in 19,000 in the New York. And this human error can be avoided to become a fatal or a sentinel event by following the three important steps either at the ward or in the blood bank, and also by following the processes and policies as per the hospital policy. The three important steps that are to be followed by the nursing staff or the doctors involved in the transfusion of the blood at the ward are: first is appropriate order or a complete request form for the component that is required. The second step involves the collection of the pre-transfusion sample after identifying the patient ID band and also the clinical record which is written by the consultant in order to match the name and appropriateness of the patient's UHID number. The third most important step is administration and monitoring of the transfusion process, which is nothing but the final bedside check. Now, prior to administration, the patient is also explained about the transfusion reactions which can occur. If the patient is unconscious, then the relatives are educated regarding the complications. After this, the venous access is established, and if any pre-medications is to be given, the pre-medications are administered. No medications are to be given at the or during the transfusion process. Once this is complete, the blood unit that is procured from the blood bank is checked for the correctness, as it is called also the timeout. Now, the timeout is done if with regards to the patient labeling and also the patient label on the blood unit. If the unit which is sent from the blood bank is the same unit as that is required by terms of whether the component that is required or the ABO group. The third important thing here is again the expiry date of the unit has to be checked, and what time the unit was received from the blood bank. All transfusions should be started immediately, and there should be no loss of time, and if the patient needs to go for any other procedures, all this should be taken care of before the unit is received from the blood bank. So once we are the doctor and the nurse, two checks are done by them individually, and they find that the unit is correct in all terms, and they sign off the timeout form, the transfusion can be started. Now, before the transfusion is started, the vital signs are also to be recorded. Before pre-transfusion vital signs are recorded, and then the transfusion is started, and after this the post-transfusion vitals are recorded every 15 minutes and then every half an hour in the next 1 hour. Prior to starting the transfusion, it's also very essential the nurses start the transfusion very slowly, because if there is any reaction, this reaction can be caught within the first 15 minutes or so, and the harm caused to the patient would be very minimal. So once the transfusion is completed within the time frame, the form is again filled up with form is filled up, and then it is sent to the one copy is put in the medical record of the patient, and the other copy is sent down to the blood bank. The three important steps that are to be followed in the blood bank is when we receive the sample and the request for the appropriateness of the sample and also the request form with regards to the label. If there is any misinterpretation in the label or no label, then such samples are kept aside and the ward is informed to send a fresh sample. Now, once the fresh sample comes, the technician processes this for cross matching. The cross matching here again is started by first checking the blood group of the patient sample that is received and also the blood unit that has been picked up for cross matching. A quick blood grouping is done to confirm the group which is already released by the blood bank, and then we proceed further for doing the cross matching. Once the cross matching has been compatible, the technical supervisor will again cross check everything and put her signature and make entries into the register. Now, at the time of issue, as we receive the issue slip from the ward, the technical staff in the issue section will do an electronic cross match in the LIS and then confirm if the unit which is being issued is not physically damaged by means of any hemolysis or any change in color, and then issues the unit, which is again cross checked by another technician, and along with the cross matching report the unit is issued to the ward. So here again in blood bank it is mandatory that we follow that 2 technicians are involved in the entire processes of these 3 steps, which makes the human error avoidable.